Hi, my name is Brianna Snyder, and I'm a Board Certified Behavior Analyst with Brett DiNovi and Associates. This video will cover 5th edition task list items I-2 and I-5. In this video, I'm going to discuss how to use the Performance Diagnostic Checklist Human Services by Carr et al. And Carr and Wilder to help improve staff's adherence to the new protocols based on the Centers for Disease Control and Prevention, or CDC guidelines. Since the CDC guidelines are ever-changing, it's important to focus more specifically on the checklist in order to ensure that staff are maximizing their job performance regardless of the guidelines. The Performance Diagnostic Checklist Human Services assesses the performance of staff who are responsible for providing care to others, specifically in human service settings. In short, it is called the PDC-HS, and I will be referring to this checklist as such for the remainder of this video. Before using the PDC-HS to assess staff performance, please make sure that all staff have received and reviewed the appropriate CDC guidelines to ensure safety of all staff and learners. This process may include an infection control fidelity checklist that displays all of the behaviors that staff need to engage in to maintain proper infection control procedures. This fidelity checklist may include staff wearing masks, washing hands or using hand sanitizer, and remaining 6 feet apart from other staff or learners when appropriate and possible. Before we talk about each section of the PDC-HS, it is important to note that Carr and colleagues in 2013 and Carr and Wilder in 2016 also included intervention planning to assist in areas whereby performance deficits were noted. As I go through each section of the checklist, I will also describe possible interventions. Under the training section of the PDC-HS, it's important to assess whether the staff member has received training on the new infection control procedures. The staff person should be able to accurately describe the new procedures and perform the tasks at the appropriate speed. For example, staff should be able to describe that he or she should be wearing a mask at all times, staff should have their temperature taken upon arrival, and wash or sanitize their hands. When possible, behavioral skills training should be included as best practice to address and improve any performance deficits. When assessing task clarification and prompting, which is the next section of the PDC-HS, supervisors should ensure that staff have access to the infection control fidelity checklist, or when possible, include a visual sign at the job site. The environment should be set up in a way that the staff member is able to complete the required task based on the infection control fidelity checklist. If the staff person is not able to adhere to the fidelity checklist, additional prompts or changes in the environment may need to occur. With regards to the next section of the PDC-HS on resources, materials, and processes, staff should be provided with the appropriate materials related to the infection control fidelity checklist. Masks can be supplied, as well as individual hand sanitizers. If any other materials are required, the supervisor should make sure they are available to all staff. Readily available materials will remove any potential barriers or deficits in this portion of the PDC-HS. Performance consequences, effort, and competition, which is the final section of the PDC-HS, are going to play a major role in increasing staff adherence to the infection control procedures. In order to increase staff performance related to these procedures, reinforcement will need to occur in the form of behavior-specific praise, scans for adherence to the fidelity checklist, or a bonus for following the fidelity checklist. Scans for adherence may be exchanged for a tangible item, such as a t-shirt or an individualized reinforcer, once a certain number of scans are reached. Performance monitoring should often occur, especially when the infection control procedures are initially trained. As the staff member increases one's performance surrounding these procedures, the supervisor will be able to fade back and allow for this staff to self-monitor their progress. When supervision occurs, feedback should always be given, and progress on completing the task should be provided. If staff are not able to adhere to the infection control procedures, increased supervisor presence may need to occur and behaviors may need to be shaped. It is important to remember that when providing feedback, it should include highlighting tasks that were performed correctly, as well as any tasks related to the procedures that were either not performed or were performed incorrectly. As the CDC guidelines continue to change and modifications are adapted related to the COVID-19 pandemic, it is important that staff members are notified of changes as soon as possible. This ongoing communication will allow for continued adherence to the infection control procedures and will help keep all of our staff and learners safe in the treatment setting. Thanks so much for watching. For additional content related to this topic, please subscribe to our channel.